to step out of the event. In staying in the event, you are agreeing to be recorded in accordance with the GDPR. So I would like to start this event now immediately by handing over to our host for the event, MEP Frances Fitzgerald. Frances Fitzgerald is an Irish MEP. She's from Dublin. She has served in the Dáil as Deputy Prime Minister from 2016-2017 and brings with her a wealth of 20 years of experience in politics. Frances has been very committed to women's rights, gender equality, and issues around breast cancer care. And we're delighted to have Frances open the event for us today and tell us a little bit more about the initiatives we're going to hear about. Frances, over to you.
Thank you, Petra, and good morning, everyone. Delighted to be joining you here this morning. What an important day for us in terms of the discussion around breast cancer care. And I can guarantee you that by the end of this event, we will have shared an awful lot of useful information, and we will have many pathways forward pointed out to us in terms of how we can all work together. I want to particularly welcome, of course, our Commissioner, Stella Kyriakides, Commissioner for Health and Food Safety, an absolutely key person in terms of the work we have to do up ahead, particularly at this challenging time. Colleagues, members of the panel, and all of those listening, thank you for joining us this morning. I think this Transforming Breast Cancer Initiative will be an exciting event for all of us. I also want to thank my fellow MEPs, Patricia Toa and Alessandra Moretti, for supporting the event. And indeed, we have a lot of MEPs joining us, and I really do want to welcome all of those, like Roberta Metsola, Elena Curantura, Ostermal Dacainia, Nicholas Gonzalez-Cesares, and Pietro Fiocchi, just to mention a few. Important to have broad support across the Parliament for this work. Look, it's an honour and a pleasure to have our Commissioner here with us. We know the issue of breast cancer has been very close to your own heart, but you've also been a superb supporter of the Transforming Breast Cancer Initiative, which is hosting this event. The Breast Cancer Initiative, it's a multi-stakeholder group. I'm a strong believer in partnerships, and this is a partnership that was established in 2017. It's policymakers, it's patients, it's professional organizations and companies, all deeply committed to breast cancer care, and it's a collaboration. And I think in collaborating, we can reach the goals we have of reducing the social impact of breast cancer, because we're speaking much more now about the social impact, but we also want to elevate it as a health policy priority, thereby improving both the prevention, the diagnosis, and indeed the care. And you will hear in the course of the morning, what is the state of care across our member states? It does vary, so there's work for all of us to do. We've been working hard since the last couple of years to ensure that breast cancer remains at the top of the EU and member states' agenda in the field of health. The European Beating Cancer is a critical part of this, introduced by the Commissioner. And that means we keep up the political momentum. We have to continue to influence governments and indeed all of our member states. It's a very challenging year, and we look forward to hearing more about this proposal later in the year. Breast cancer, as everybody joining today knows, remains the most prevalent and deadliest form of cancer for women. Ireland, we have 3,000 cases diagnosed every year. There's still much to be done in terms of prevention, in terms of aftercare. We'll hear today about the right to be forgotten, a very interesting concept. We'll hear about the challenges when it comes to the workplace and employers. And we need to help employers to understand and make the best decisions with their employees during a period of treatment and aftercare. Yet the issue of breast cancer prevention, care and treatment, of course we know it cannot be considered in a policy vacuum. And the COVID-19 pandemic raises a whole separate set of challenges. We know that people are somewhat reluctant to go to health services. They're nervous about COVID-19. And yet we know for breast cancer, early care and prevention is so important. and delay can be very serious. So how do we reach out to our women at this moment in time, and indeed some men? How do we reach out to make sure that during COVID, there are still quality procedures available? That's an absolutely critical aspect of what we need to do at the moment, to make sure if people have symptoms, they talk to their doctors, they get some help. For this reason, more than ever, it has to remain a top priority for policymakers working together, as I say. This cause has always been close to my heart. It's also an equality issue, of course, in terms of healthcare. And I really think that with the changes going on at present in the Commission and across the Parliament in terms of the intergroups, the cancer groups, the interest in various political parties across the Parliament on this, it is a critical time. It's a time of crisis, but it's also, like every crisis, it can be a time of opportunity. So we want to add to the discussion here today, and we really look forward to everyone's input. It's a long session, it's an hour and a half, but I can guarantee you it's worth staying tuned in to hear the range of experts we have from all the different areas, the NGOs, the scientists, the doctors, and the women themselves. So thank you very much indeed, Petra, and I look forward to a very interesting morning.
Thank you very much for that rousing introduction, and I can only urge everyone else, do please stay on, because we really do have an exciting group of presentations for you. And we're very honoured to have with us today Commissioner Kyriakides. She's of course the Commissioner responsible for health, and we're delighted to have her with us, not only because of her personal commitment within this domain, having previously been served as a president for Europa, Donna, European Breast Cancer Coalition. Commissioner Kyriakides, we're delighted to have you with us. May I invite you to give your keynote address? We're aware, of course, that as always, you have many demands on your time and you may not be able to stay with us for the full session, but we're very anxious to hear your keynote to us today. Commissioner. Thank you. I think you may still be on mute.
That's all right. Do you hear me now?
Perfectly. Thank you very much.
Thank you. So good morning, everyone. It's really a great pleasure for me to be able to be here with you today. And I'm sorry that, as you said, I will not be able to stay on for very long. But we are facing, as we are all aware, a very challenging situation with the COVID-19 pandemic. So I'm really, I would say, honored to be able to join this meeting. October has always held a very special place in my heart for me for the last number of years in terms of breast cancer advocacy and awareness. At the time when we join our voices across Europe and across the world to make a difference in this disease. My journey with breast cancer started many, many years ago when my mother was first diagnosed with the disease. And it was at a time when nobody spoke about breast cancer. It was at a time when breast cancer was, as cancer was in many, many parts of the world then, almost considered a stigma. So it was, I learned how it was to live through that disease as a member of a family. And then many years later, when I was myself diagnosed for the first time with breast cancer, I was able to see it from a different perspective. So I feel that part of what we do as breast cancer patients, as advocates, really is to raise awareness about this disease, to make a difference, and to change the realities of a disease that affects so many women and their families across Europe and across the world. People dealing with this disease, patients, doctors, nurses, psychologists, and families face this disease every single day, and it's not just October. October is a time when we are able to highlight it, but we cannot close our doors on any other day of the year and forget about what we need to do in terms of fighting breast cancer and cancer. We can shine a light on this disease every October, but we need to be aware of what we need to do to change the realities of cancer every day of the year. So I want to really thank you and thank all those involved in the Transforming Breast Cancer Together initiative for all the work, for organizing today's event. And I sincerely hope that we are able to overcome the COVID-19 pandemic, and I'm able to join you physically at the next event. This has been a really challenging year for us all. COVID-19 has changed almost every aspect of of our lives as we knew them, the way our social contacts, the way we work, children going to school. I think that there's no doubt about it, that it has had a tremendous impact on everyone at individual level. But I have had the opportunity over the last few months to talk with many patient organizations and have seen how this pandemic has been particularly difficult for cancer patients and their families. It has disrupted treatments, it has disrupted access to screening and the running of screening programs. It has affected access to medicines, and it created an unbelievable amount of anxiety and stress for patients who had to access hospitals because of the fear of COVID-19. I want to assure you that cancer has remained a top priority for us as a commission. When I first became commissioner on December 1st last year, and Europe's Beating Cancer Plan was placed as a priority by President von der Leyen in my mandate, I never believed that I would find myself in the position of being the person in the commission to deliver on this plan. And we have not taken our eyes off this throughout the pandemic. So we are going to be coming forward with the Europe's Beating Cancer Plan early December of this year. This is very important for us because we want to highlight what we need to do about cancer, but also from the lessons learned because of the pandemic. We want to incorporate the many lessons learned which have highlighted the inequalities we knew were already there, the difficulties in access to medicines that we knew were already there. We will be incorporating them in Europe's Beating Cancer Plan. We are moving in the right direction in Europe in many areas. Things have changed dramatically over the last 30 years. There are now more specialized breast units for breast cancer. There are more specialized screening units, but there are still inequalities between and within member states. And these inequalities reflect on survival. And this, for myself and for us as a commission, is not acceptable. We need to address these inequalities, and we will be doing this through the Europe's Beating Cancer Plan. We need to have recommendations which are going to be converted into quality indicators so that member states can then implement them. A recent Eurostat study showed that in one member state, 82% of the women receiving between 50 and 69 received mammography within the last 2 years as part of a national screening program, while in another member state, the number stood at less than 0.5%. So we can all understand what this means, because when we say that early diagnostics saves lives and screening is important, we need to ensure that this is available for women across the member states. I am sure that with your cooperation and with your support, we'll be able to do a lot more to respond to these unmet needs, and we will be able to really address the whole disease pathway. I heard you mention the right to be forgotten. Well, the Europe's Beating Cancer Plan will be addressing the whole journey from prevention to early detection, to treatment, to palliative care, addressing those living with metastatic disease, to quality of care, and to the problems and difficulties faced by survivors. It is very closely linked to the mission on cancer, so that we can ensure that the gaps in advanced cancer treatment and care are addressed, and that knowledge is improved. This is a collaborative effort. Nobody can deal or can change the face of the realities of cancer alone. We are working across the Commission with a number of my colleagues in this. We're working with member states, we're working with stakeholders. For us, it is very important that we're able to collaborate with all, and I would say that one of our key partners is the new European Parliament Special Committee on Cancer. So those who know me will know that I always say that patients need to be the center, and they are, of course, at the very center of this plan. They will continue to be the center in the coming months and years, but we need to work in partnerships with everyone and with all stakeholders, with the scientific community. Everybody needs to be together, and this is a plan that needs to be as inclusive as possible. I look very much forward into being able to present this plan in December, and to hearing from you following this, because this is going to be a plan that will have actions that will be implemented over the coming years. The launch of the event of 4th of February, the European Parliament, seems many, many years ago. So much has changed in the last 10 months, but we have never changed what we have had as our focus. And our focus is to come forward with an ambitious plan, a Europe's Beating Cancer plan that will involve everyone, and that we will be able to use all the synergies that are now in place to transform the face of this disease for so many cancer patients in Europe. I want to thank you once again. These events and the participation of so many unbelievable women for me are inspiring at a personal level. I find them moving because I always learn from stories, and these are lessons that I have taken with me over the last many years as a breast cancer advocate. So I will end here by saying that I always have said we wear pink in October, but pink isn't just a color, pink is an attitude, and together we can make a difference. And together we are able to strive for more and change the realities of breast cancer for so many women and their families across the member states. So once again, thank you for allowing me to just be part of this inspiring event. And I hope that we'll be able to share in a physical presence way as soon as the pandemic allows us. Thank you.
Thank you very much indeed, Commissioner. Now, I know you're very busy today, so we're not going to share with you right now many of the questions that we have coming in, but to the audience, do please continue to ask your questions. We will actually share these questions with the Commissioner's office afterwards so that she is aware of the issues that you've raised. And I know that issues such as the full cost of cancer care to patients is something she has firmly in mind. And I just want to draw your attention to one point, which is that we sometimes forget that men also are affected by breast cancer.
Yes, if I may here, I don't forget it. This is something that is always in my mind. We do know that men is a very small percentage, but men are also affected by breast cancer, and we need to address that as well when we speak. And you're absolutely right. And possibly sometimes they feel more left out because we have this huge pink movement every October, and it makes it more difficult for them. But in many countries, men have joined in. And for the other point, I just wanted to share with you that, as you know, we have proposed a very ambitious EU for Health program. That has been significantly reduced, but there's still negotiations going on with the Council and the European Parliament. But even as it stands now, it's significantly increased to what we had for health in the EU, and a significant part of that will be devoted to the cancer plan and to the implementation. So our cancer plan will have a significant amount of funds devoted to it through the EU for Health program. Thank you.
Thank you so much for that extra clarification. I'm sure you'll stay with us as long as you can, but we're now going to move over to our presentation panel. So thank you again to the Commissioner, and we note that you're very actively using the questions and answer session. Do please continue with that. I'm now very proud to welcome our panelists. We're going to move through 4 presentations. We have 4 remarkable panelists with us. If we could just have the slide showing our 4 panelists, please. I think, do we have the slide with our 4 panelists? I think it's, there we are, it's just coming now. So we're going to begin with a presentation from Marisa Zambon from Europa Donna. She is a lawyer of 25 years experience, and she's going to tell us a little bit more about the work of Europa Donna in recent projects, and also her role in the Transforming Breast Cancer Together campaign. We will then hear from Barbara Wilson, and I will introduce the other speakers as we go through so that we can move ahead properly on time. So with that, I would like to give the floor now to Marisa Zambon from Europa Donna. Marisa, please go.
Good morning. Good morning to all. My name is Marta Zambon, and I am the Director of External Affairs of Europa Donna. My contribution to this discussion will consist of sharing the results of a survey that Europa Donna, the European Breast Cancer Coalition, circulated among its 47 national organizations during the months of July and August 2020. And the report has been published, and you can find it on our website. Next slide, please. The survey's aim was to assess the current state of breast cancer services as perceived by our 47 national patients organizations, 27 of which are based in EU countries. Our intention here today is to provide you with the voice of the patients, data from the real world in view of the upcoming European Cancer Plan. And we are particularly glad that this webinar takes place today on the 15th of October. Ever since 2008, Europa Donna established Breast Health Day on the 15th of October. And the program aims to inform women of all ages that lifestyle factors play an important role in prevention and recurrence of breast cancer. Next slide, please. Here's an overview of the survey that we carried out. As you can see on the slide, we prepared a questionnaire with 52 questions divided in 5 main sections, and we received 34 complete responses, 24 of which from EU-based national organizations. Questions covered on important issues from cost coverage, reimbursement policies, screening and program and technology, specialist breast cancer unit, multidisciplinary teams, the existence of national certification or accreditation systems, legislation protecting the right to return to work, access to insurance, and a whole section dedicated to metastatic breast cancer, which Europa Donna has made a priority in all of its programs and policies and activities. Next slide, please. So, allocation of costs. Results showed that healthcare is largely set up on a national public level. Breast cancer care is mostly provided by public health facilities. Private facilities are still playing an important role. In 84% of countries, all costs for diagnostics, treatment, and therapy for breast cancer care are paid for by public care system. But just over half of the responding countries, 52%, including Italy, Greece, Latvia, and Ukraine, responded that in some cases, such as genetic or genomic testing, some or all costs must be covered privately. As many as 76% of respondents claimed that the cost of supplementary aids, such as wigs and lymphatic drains, and follow-up care are reimbursed, at least in part, by their health system. Next slide, please. 79% of respondents said that their country has national programs or campaigns for primary prevention, such as promoting healthy lifestyle, fighting obesity and smoking, and that would grow to 87.5% for respondents within the European Union. On the other hand, much is still to be done on a national level regarding the rights of breast cancer patients and survivors. Only 54% said that their country has passed legislation protecting or implementing breast cancer survivors' right to return to work. Only 42% of countries have passed legislation protecting or implementing survivors' right to access insurance. And just 12% of respondents reported that their countries had passed a right to be forgotten legislation for cancer survivors. And that will include Belgium, France, Luxembourg, and Israel. And the above low numbers are not surprising, as 53% of respondents reported that they do not have committees or advisory board or groups in their national parliament or governments dealing with breast cancer. And this is a great area for potential advocacy in many European countries. Next slide, please. On national screening programs, 74% said they have an organized population-based breast cancer screening program, and this figure goes up to 83.3% in EU countries. 68% indicated that women between 50 and 69 are invited to attend mammography screening every 2 years, and this figure goes up to 75% in EU countries. 62% reported that breast screening is performed through state-of-the-art technology, such as digital mammography or digital breast tomosyntheses, leaving us, though, with quite a high 38% of countries which do not. And anyway, the good news is that 94% of women diagnosed with breast cancer usually begin treatment within a reasonable time from the date when they receive their diagnosis. Next slide. Only 55% of respondents indicated that their country has specialist breast units with certified multidisciplinary teams. This figure rises to 68% in EU countries. Several comments said that the specialist breast units are not certified, or as one put it, far from meeting the USOMA standards. In many countries, they are not well distributed on the territory, and they do not cover the entire population. Out of the 55% of countries which have specialist breast units, 53% meet the minimum size criterion, 66 feature multidisciplinary teams, but a good 71% of existing specialist breast units were reported to offer state-of-the-art equipment and high levels of treatment. On the negative side, only 34% of respondents indicated that a national or USOMA certification accreditation system exists for specialist breast units, and 41% said that there's some kind of authority in charge of monitoring the quality of specialist breast units in their country. Next slide. Finally, the results of the survey, especially focused on metastatic breast cancer services, were not exactly brilliant. More than 35% of European women living with metastatic breast cancer do not have access to specialist breast units in their countries, and this figure goes down to roughly 30% in EU countries. 50% lament the lack of counseling and advisory services for return to work, financial and family concerns, and almost 66% of respondents state that there is a scary lack of data in very few registries recording metastatic breast cancer cases. Last slide. So here is the explain it to me as if I were a 4-year-old version of the survey's result. As you can see, specialist breast units still have much work to be done in terms of implementation, distribution on the territory, and guideline compliance. A proper accreditation certification of levels of service is widely lacking. There is definitely space for improvement in health policy, on genetic and personalized medicine. And finally, advanced and metastatic breast cancer are still an area still suffering widely of widely spread disservice, both health and social wise. We will follow up with more details, focusing specifically on EU member countries. And thank you very, very much for your attention. I now pass the floor back to Petra. Thank you.
Marisa, thank you very much for that lovely presentation and for the information that you shared with us. We have several questions within the question and answer panel, and I'm just going to ask you to focus on one particular issue because there are so many questions there. But I do want to ask you a little bit about the use of the question that's arisen that women are exposed to too much radiotherapy. Is there anything in your work that you've done that helps you reassure people about the way in which the radiotherapy decisions are made in Europe?
Well, I mean, there is a lot going on with clinical trials and with research, and as Europa Donna, we are very much involved in that. It is a great concern for people undergoing treatment, that non-invasive treatment is be possibly preferred, and we are working especially on personalized medicine. I actually attended EAPM presentation the other day, and we're all working on this. It just needs to be, what the best solution would be to reach personalized solutions.
Thank you. Thank you. Now, I know you can't do justice to a complex question like this in a session like this, but I did want to acknowledge that we'd had a couple of questions on that issue. Thank you very much, and I'm sure we'll come back to these issues later. Thank you for your time now. With that, I would like to hand over to our next presenter, Barbara Wilson, who is going to talk to us a little bit about the challenges of the unmet needs of cancer patients and returning to work. Barbara Wilson is the founder of a social enterprise called Working with Cancer, which she founded after her retirement from corporate life, where she worked in several investment organizations, including Schroders Investment, Barclays, and Price Waterhouse. She launched Working with Cancer as a social enterprise to provide coaching, training, and consultancy services to anyone affected by cancer to manage their return to work. And we're very pleased to have her with us and to learn about the importance of working with cancer. So, Barbara, over to you, please.
Thank you very much, Petra, and I'm delighted to have this opportunity to talk about work in cancer. I'm going to talk about the main challenges cancer survivors face returning to work during and after treatment, with particular reference to breast cancer and advanced breast cancer, and how I think those challenges can best be addressed by the cancer plan. Let's be clear, more and more of us are surviving cancer, and most cancer survivors, breast or otherwise, want to go back to work for their social and economic well-being. To use that rather well-worn phrase, we all want to get back to normal. But this issue is often overlooked, in my view, neglected in many countries, probably because it straddles health and social policy. It doesn't fit into a neat box, and it's been largely left for national governments to manage. But being able to work with or after cancer, having that choice, is, in my view, a fundamental right and of critical importance to our society and to our economies. And in the meantime, this policy neglect has led to very large disparities in Europe in the way people are treated, both during and after treatment, when it comes to returning to work or finding employment. So first of all, as you can see here, I'm not going to blind you with too many statistics. You know that 1 in 8 of us with breast cancer will have breast cancer. It's probably now more like 1 in 7, I have to say. Of that number of people with breast cancer, about 400,000, over 50% are of working age. But the critical point here is that most cancer survivors of working age want to work for a whole variety of reasons, but fewer than 2/3 would have returned to work or will be working a year after their diagnosis. And in 2013, I know it's a few years ago now, it showed the figures show that the loss in terms of working days was costing Europe then over 9 billion euros. I'm sure it's a lot more now. Next slide, please. So what are the typical challenges that breast cancer survivors face when they're returning to work? Well, let's be clear. Most breast cancer survivors don't actually understand all the issues around their cancer, particularly the side effects, which often begin after treatment's finished. They result from the medication. And they certainly don't understand that recovery isn't linear. It's a roller coaster. Most employers don't understand that either, so they don't provide adequate support, often because they don't know what to do. Neither side are equipped to talk effectively and constructively about cancer. There's still the issue of stigma in many workplaces in many countries. And particularly important, healthcare professionals typically, not always, but typically provide inadequate information about work and cancer. They will often say, for example, I don't know a lot about work. Go back to work when you're ready. Well, how do you know when you're ready? And then as a result of this in the EU, there has been, as we've said already, huge disparity and inequalities in employment practices. And as was set out in an ECPC report on disparities in cancer, employers don't consider job preservation approaches that acknowledge a patient's residual work capacity. Next slide, please. I want to speak for a moment then about the challenges for those with advanced breast cancer, because they are an invisible group. They often, people with advanced or metastatic breast cancer look really well. They will be dealing with life-changing side effects, physical, cognitive, and psychological. They will be dealing with side effects which are persistent, invisible to the naked eye of their employer or colleagues, and fluctuating. They may be feeling fine one month and not the next month. They are particularly grappling with periods of wellness which are uncertain. They don't know how long they're going to be well for. Their treatment plans will be changing. A standard working week may not be possible for them, for many of them. On the other side, their employers and colleagues won't have a clue about what having advanced breast cancer means. They may think they're about to die imminently. They will have told them to go and tick off things on their bucket list, whereas actually they may have 4, 5, 6 or more years of healthy life ahead of them, relatively healthy, when they contribute to work and to society very effectively. And last but not least, most employers have very inflexible working policies and practices. They don't believe or haven't believed until COVID-19 in flexible working or home working. People who ask for these, they might believe, aren't committed, sufficiently committed to the workplace. But dealing with these challenges does not mean people cannot work. We work with many people with advanced metastatic breast cancer who work very effectively with their condition. So how do we deal with this? Next slide, please. Last but not least, I think the new cancer plan should include 3 important features. I think first of all, there should be a dashboard which measures and monitors return to work in each country, and that each country can be held accountable for how effective or what their measures they're undertaking in this area. Secondly, I think it should be made illegal to discriminate against those with cancer or frankly any chronic illness, and establish the right to be remembered. So employers provide adjustments and support when or if an employee needs to disclose their cancer. This is particularly important for those with recurrent breast cancer, or for those who have advanced or metastatic breast cancer, where they need to have reasonable adjustments to enable them to work effectively. And last but not least, COVID-19 has shown us that actually flexible working for many of us, not for all of us, I admit, but for many of us, working from home is possible. So let's make that a day one right for any employee who is able to work from home. In my view, implementing these three changes, I know these are around social policy, perhaps more than health policy, but these three changes will make a significant difference to cancer survivors' lives. It will lay the foundations for real change and enable many more of us to make a successful return to work. Thank you.
Thank you very much indeed, Barbara. We're going to come back to some questions later, but as we're already a little bit tight on time, I'm going to actually refer a question to you on the chat session, but we will come back to it. I want to now move to invite Grazia Zocca from the European Cancer Patients Coalition to talk about in particular, the Right to be Forgotten project on which she works. And I think this is, of course, important because Barbara has just been speaking about the right to be remembered and the importance of remembering people with cancer in the workplace. But we also need to consider the idea right to be forgotten, which was also mentioned by the Commissioner. So Grazia Zocca from the ECPC, which she joined just in February. So one of those people who joined a new job during the lockdown period, which cannot be easy. And she joined that after finishing a PhD in law, focusing particularly on public health issues and human rights issues. So, Grazia, can I hand over to you, please?
Yeah, thank you so much, Petra, for this kind introduction. Just for a technical issue, I think we can also move without the slide because considering also the time, probably is better going without. Just with videos, it could be perfect. And before to start, I would like also to thank you, the organizing committee of this special event, and thank you also my organization, the European Cancer Patient Coalition, for giving me the opportunity to join here today this distinguished panel marking the Breast Cancer Awareness Month. Yeah, definitely, I will move presenting a bit the right to be forgotten. That is something, according to our vision, different regarding the right to be remembered, as Barbara just presented. And my contribution here to this debate today aims to highlight a bit the attention on one of the high side, I should say, of a cancer diagnosis, which is life after cancer. And with this, I'd like to stress a bit more the need to expand the strategy to beating cancer to a more holistic approach, which includes the concept of full rehabilitation of cancer patients that then become a cancer survivor, taking into account not only the concept of cancer treatment and cancer care, but also all the complex issues that are related to the social and economic impact that a cancer patient and his family need to face in the moment he received the diagnosis of cancer. We know that currently there are more than 20 million of cancer survivors in the EU. Data shows that hopefully more and more citizens survive cancer. In particular for breast cancer confirms to be among the other cancer diseases that continuing fall in total cancer mortality in the EU. For sure, this means that a lot has been done, but still a lot of things can be improved and needs to be improved on this. More and more also according to the concept of cancer survivorship in this. We know that a cancer survivor needs to overcome numerous challenges that go with the medical long-term effect, the psychological impact of the treatment and the disease, the workplace marginalization, as we saw with Barbara in a moment, and the access to financial instruments such as loans, mortgages, and the life insurance that are needed when a cancer survivor needs to buy a house or just more easily finance a new professional project. And these obstacles risk-bearing instrument of discrimination for cancer survivors, leading to a double feeling of penalty, just hindering many of them from coming back to a normal life. And regarding the right to be forgotten, that is what I'm working on within ECPC in the moment, the exclusion of cancer survivors to contract life insurance that in many EU countries are the necessary instrument to access to mortgages, loans, make property, and also, as I said, also finance a professional project completely impossible in many of the EU countries. That's why, in this regard, the right to be forgotten can be the key instrument to avoid any kind of discrimination and ensure equality. And for probably many people in this webinar can be not very familiar with the concept, but the right to be forgotten consists of a legal provision, of a proposal of a legal provision that ensure transparency in the practices of credit worth assessment, ensuring so the access to, and also ensuring the best interest for cancer survivors in the moment when they ask for borrow money, without also the need to pay kind of extra fee that are also usually demanded by banks and insurers. The good news is that there are EU countries that implemented the law and implemented the right to be forgotten in their national system, has been already introduced before. But France, for example, has been the first EU countries opened the debate on this in 2015 and implemented the law on the right to be forgotten. That progressively became a kind of model for other EU countries, as for example, Belgium and Luxembourg implemented early this year a provision on the right to be forgotten as well. And as the latest update, we know that the Netherlands announced during summer a law-making process to implement the right to be forgotten by January 2021. I don't have time to go into the details of each law and each measures. What I can say is that the three initiatives have in common the principle to ensure access to financial instruments such as loans, mortgages, and the insurance itself, without the obligation to declare the past cancer experience, and also without the possibility to apply extra fee. This is possible after 10 years, the end of the active treatment, for sure, without relapse. Moreover, and this is also particularly relevant in case of breast cancer disease, is that the three initiatives also provide a kind of list of exceptions for cancer known to have a kind of good prognosis, and in this there are a lot of breast cancer diseases included in this list that provide also terms shorter than the 10 years in order to benefit the right to be forgotten. So this is a kind of general overview on the right to be forgotten. And what we are doing within ECPC is that since February 2020, under the coordination of Dr. Françoise Meunier and within ECPC, we are working on a legal research project on the right to be forgotten. The project aims from on one side to assess and analyze these issues, so the issue relating to discrimination for cancer survivors accessing to financial instruments, and on the other side, studying the ongoing and monitoring the ongoing implementation of the right to be forgotten at national level, but as well as studying a kind of pan-European approach to these issues. That's to the issue. That's why I'm very happy that the right to be forgotten has been mentioned by the Commissioner and also included in the EU Beating Cancer Plan and the Cancer Mission Report on Cancer as well.
Thank you.
So I'll be very happy to answer to your question probably in the second part, and thank you for your attention.
Thank you very much indeed. And I think we've raised two very interesting topics here, and we can see on the chat that this is also something that is arousing a lot of interest. We are, as always in these events, running tight on time, so I'd like to thank you very much, Gracia, and pass over to our next presenter, Dr. Fatima Cardoso, who is Director of the Breast Unit at the Champalimod Clinical Center in Lisbon, Portugal. She is a board-certified medical oncologist and also a practitioner in internal medicine. She has so many issues, so many credits in her CV that I can't possibly go through them all. But I'm delighted to invite her here with us today to present about the ABC Global Alliance Awareness Campaign and the challenges of the invisible woman. Dr. Cardoso, please.
Thank you very much, Petra, and thank you very much for the opportunity to present these projects. So I will be very briefly presenting to you 3 projects that are coordinated by members of the Transforming Breast Cancer Together project. And I will start with a presentation very briefly of the ABC Global Alliance. ABC stands for Advanced Breast Cancer. And this effort started many years ago, back in 2006, when questionnaires and surveys have shown how forgotten this group of breast cancer patients felt. And these were mostly women, but also, as we have already discussed, men as well. And because of that, we have created first a set of guidelines to how to treat this disease, then a dedicated conference, and then the movement that was created around the conference showed that there was so much need that we created this global alliance, putting together all types of stakeholders that would like to develop projects specifically for this group of patients that represent 1/3 of breast cancer patients, and believing that getting together and collaborating and sharing resources and knowledge is the way that we can move forward faster. So we now have more than 150 members in 75 countries around the world. Now, the first thing we did was to define goals, objective, achievable goals for a period of a decade. And why have we done this? Because we have done a decade report looking into what happened in this field between 2005 and 2015. And we saw that unfortunately, during this 10-year period, all we could do was increase 2% in the percentage of women that are alive at 5 years with this disease, from 25 to 27%. So clearly we need to do things differently. And we have defined these 10 goals, and this is our charter that has been translated in more than 17 languages and can be used both as a lobbying tool, but also for politicians and policymakers to know where to focus their actions to change the outcome of this disease. One of these goals is to fight stigma, which is the one I decided to focus to show you one of the many projects that the Alliance is doing. Why have I chosen this one? This is one of the findings of the decade report. And you can see below many types of countries, low-income countries, high-income countries. And in all of them, 1 out of 4 or 1 out of 5 of the public people, so the general population, believe that patients who have metastatic disease should not speak about it unless with their treating physician. So stigma is very much a problem these days everywhere and in all European countries. Because of that, we have created this awareness campaign, and we like very much to promote it during the October month so that everybody just does not think that October month is only about screening and early detection, although these are very important goals. So I will show you a very brief movie that speaks everything that I cannot speak in my own words.
It sometimes feels like a price has been put on our life, and that isn't right.
They just look at you as a walking corpse.
You know, I am living probably their worst nightmare.
it is treated like a curse.
They can't understand that there's no happy ending, no getting better.
No, let's not use the money for treatment because she's gonna die anyway.
Thinking about my kids is difficult.
I am
Advanced
Breast cancer.
So I think you will agree with me that this video shows you everything that these women and men also feel. So moving on to the other project that is where the Alliance is participating, but it's coordinated by Novartis. Back in 2013, when we did the Decade Report, we also did this, the launch of the Here and Now campaign and the Invisible Woman report. And now, 7 years down the road, the same questionnaire was applied to see if things have changed. So I can summarize in a sentence saying some things have changed, but there is still so much work to be done. And what does this questionnaire shows us? So just to tell you that this covers 8 European countries, 98 responders between patients and also carers, family members and friends. The personal impact, as you see there, is highlighted by 3 words: fear, grief, and sadness. And this continues to be the case both at diagnosis of metastasis, and while living with metastatic disease. There's also a societal and economic impact. Societal impact, you see that patients with this disease lose the capacity to keep family together. Remember that these are in majority women in the prime of their lives, 40s, 50s, and 60s. They also feel isolated from the early breast cancer community, and they feel that the word that defines better what society thinks of them is pity. In the financial part, I think here we can make a huge change, because here we see things are worse than they were back in 2013. The impact in employment, like Barbara already explained, is huge. 75% of these patients have to make changes, and that is translated into 70% suffering, income decline, and stress regarding this financial burden. And also the importance of information and the need for us oncologists to have time to discuss the diagnosis and the treatments with these patients. Now, I advise you to read the full report that you find in this link, and you will see many more interesting findings. Finally, the third project I will mention is one that it's in the end phase. It's already been published, and also I kindly ask you to read the paper where you will have much more information. It's called a multi-stakeholder approach to optimize patient needs in the benefit assessment process for metastatic treatments. So what does this long title mean? It means that when every one of us is assessing the benefit of a new treatment, very often the needs and what is really necessary for metastatic breast cancer patients is not taken into consideration. So not all of the issues that are important are present in the benefit assessment project. So what this project did was to get several stakeholders together, including those who do health assessment and cost effectiveness, and issue some recommendations. How can we improve this process? And very, very briefly, highlighting these recommendations. It's important that new treatments improve survival in this disease, not just other surrogate endpoints. It's important to measure quality of life, but for that, we need to have proper tools, because most of the tools of quality of life were developed for early disease. It is also crucial to have good quality data, and we don't have good quality data in the vast majority of European countries regarding metastatic disease. And also what reimbursement bodies can do is use objective scales such as the ESMO magnitude of clinical benefit scale that allow us to prioritize what can be reimbursed. Finally, 2 points is involve patients in the development of guidelines and in the implementation of guidelines, as well as make sure that all metastatic patients are discussed in a multidisciplinary tumor board, which is not occurring. It's occurring for the majority of early breast cancer patients, but not for the metastatic breast cancer patients. So thank you very much for listening.
Thank you very much for giving us this insight on those 3 amazing projects. We have a number of questions in our Q&A panel, which raise also the issue of needing to collaborate with initiatives outside the European Union. We've had attention drawn particularly to sub-Saharan Africa with a much lower survival rate, and also in other parts of geographical Europe, such as Kosovo. I'm going to invite our panelists to answer any of those questions by text rather than answering the questions, but I do want to acknowledge the questions and acknowledge to our audience that whilst this is a particularly European initiative, and we're now going to be joined by another member of parliament from the European Parliament, there is an awareness that this is of course a problem that affects people worldwide, men, women, and whether you're in Europe or not. As we've said very many times, diseases know no borders. So Dr. Kozos, I'd like to thank you very much, and I'd like to move now to our panelist of speakers. Our speakers, you can see them on our screen at the moment, our 3 speakers. We will now have, this will be more live. We don't have slides from these speakers. We are going to, and we're going to attempt, I'm going to do my best to integrate the questions that you pose into their questions. But I would like to begin by inviting Kiran Nicol from the Joint Research Centre of the European Commission to talk to us a little bit more about the work that the JRC is doing, and in particular his work around the European Network for Cancer Registries, or the work of his unit around the Network of Cancer Registries, and generally his background, his work in the cancer field, noting that Kiran has a very long history in cancer research himself, having done his PhD around this issue in Heidelberg University. So without any further introduction, Kiran, I'd like to move to you by asking you to tell us a little bit more about how the JRC is working collaborative with the European Commission, with DG Sante, on the European guidelines on quality assurance for breast cancer screening, diagnosis and care. Kiran, can I pass over to you, please? And I think we would like to have all participants on screen now. Kiran?
Yes, Petra, can you hear me?
We can hear you perfectly, thank you.
Thank you, Petra, and thank you to the organizers, to the distinguished speakers, and thank you, participants, because the time has come to work together on this. On behalf of DG Sante and ourselves in the JRC, you will have seen that our commissioner has presented the basics of the Europe's Beating Cancer Plan, so I won't go into that, so covering prevention, early diagnosis, treatment and quality of life. What I will tell you is that this has now been translated into a list of actions. Those actions have been sent out to consultation, very, very thorough consultation process, and now they're looking to see how to leverage impact, the feasibility of implementing these actions. What I can announce to you that within the Commission, I have great news. For the first time that I've seen it, the DGs are working seamlessly together to tackle cancer. The Europe's Beating Cancer Plan is being developed in tandem with the Horizon Europe Mission on Cancer and in tandem with our Knowledge Centre on Cancer, which was endorsed by Commissioner Gabriel back on the 5th of February. So this is excellent news. We have to all work together. Up to now, there has been a little bit, the EU does this, the member states do that. Well, the EU is the sum of the member states, and the member states make up the EU. It's very simple. Now, moving on quickly to the European Guidelines and Quality Assurance Scheme for breast cancer screening, diagnosis, and care. So basically, this is about providing essential minimum standards. You've heard the word multidisciplinary meetings, patient centricity, etc. These guidelines do exactly that. Basically, the time now has come to implement them. And in Europe alone, incidence mortality figures they change by a factor of 2, depending on where you live. This is unacceptable because we know how to make that better. What's unique about these guidelines? Well, let me just tell you very quickly. First of all, they are absolutely evidence-based, not consensus-based. There is a very rigorous systematic review of the evidence by an independent team. That's really important. The internationally recognized methodologies, which are very rigorous, that we apply, then send it to 35 experts on guidelines, 35 experts on quality assurance for breast cancer, and then the recommendation is elucidated. This includes conflict of interest management, etc., etc. Unlike the past, these guidelines will always be up to date because they're updated in real time, quasi-real time, as new evidence becomes available and is assessed accordingly. So that is a big break in the past, where as soon as guidelines were printed, they were out of date. So the new guidelines are online and they are up to date. The guidelines versions are also available for 3 categories of people. Number 1, patients and citizens. Number 2, policymakers, and of course, very importantly, number 3, professionals. Finally, the quality assurance scheme, which is being developed for the guidelines, is almost now complete, and this is the vehicle for implementation in countries. Now, basically, we can produce the best guidelines in the world, and Europe often produces the best methodologies, the best knowledge. But so what if we do not implement it? And I think that's where we've been lagging behind. So anyway, in any case, the guideline recommendations have been completed, over 80 of them, they're online. The quality assurance scheme will be completed within the next 3 months. We will deliver this project early next year. And by the way, many countries are already implementing it. Let us have a look. We have Bulgaria, Czech Republic, Denmark, Estonia, Germany, Italy, Slovakia, and Spain. Outside of Europe, we have Bahrain, Chile, China, Mexico, Norway, Tunisia, and Brazil are using our methodology. So basically what we have here on offer is very, very solid, is patient-centric, and it's very good. But how we need to implement it, that's the important thing. So basically there's a lot of momentum now coming up. I'm almost finished. Between the Europe Beating Cancer Plan, between the Horizon Europe Mission on Cancer, what we need to push for now, and all DGs agree, is to look to implement these guidelines to help member states, regions, local areas to implement them. So if we do that, we will certainly address an unmet need when it comes to breast cancer screening, diagnosis, and care. Thank you very much. I hope you could hear me clearly. Happy to take any questions, and compliments again for this excellent session. Thank you.
Thank you very much. That's given us a very good overview of the work that you're doing, and I'm delighted to hear that you said that you're collaborating excellently with the Commission, and in fact that the units of the Commission are collaborating so well. We're going to return to the issue of collaboration in a moment when I ask MEP Moretti to speak, because I'm going to ask her about the initiatives that are going on in the European Commission. But before doing that, I just want to give you the opportunity, Kiran, to make a comment on some of the questions that we've had about the need for more use of evidence-based medicine to ensure that people get right dosages, particularly in things like radiotherapy. And I'm wondering, could you just say 2 words about how you're going to publicize the guidelines and ensure their uptake and usage?
Well, in terms of publicizing them, they are online and available. In terms of usage and implementation, we are now working on many fronts looking at that. Within the Commission, we have other mechanisms that were not used in the past to do so. The Structural Reform Support Service. There are many new groups where we can help with funding to implement. And indeed, dosages for radiotherapy and all through the whole pathway, things like that need to be addressed and are being addressed in an evidence-based way. I mean, that is the future. Personalized medicine is coming, stratification screening programs. So in a nutshell, we are moving in that direction. We wish we could go faster, but of course, again, it's all about implementation. This project will almost be finished. I think then we will, yes, we're also in a means to monitor the impact of it. Take screening programs. If you implement a type of screening program, you need to be able to measure to see if it is working or not. And there we have the European Cancer Information System, which now we will start encoding pediatric cancers. We will start encoding staging. Staging is really important, as you all know. We will start linking up the cancer data with other cancer determinants like particulate matter 2.5, radon exposure, etc., etc. A lot of things are going to happen in the coming months, years, and you can count on our full support. I hope that helps to answer the question, Petra.
Thank you very much indeed. And as always, it would be wonderful to have so much more time, but we never do. There's never enough time. So thank you. As announced, I would like to now invite the Alessandra Moretti, who is a Member of Parliament, to comment on the way in which not only the new Special Committee on Cancer, but also the MEPs Against Cancer Intergroup Initiative are working together, and also how you foresee collaboration with initiatives such as the initiative that is being presented here today. Is MEP Moretti with us?
Yes, I am.
There
Hello.
you are. Thank you very much. Thank you.
Thank you. Hello, everybody. Thank you for this important invitation. And I would like to excuse my colleague Patrizia Toia. She had an urgent institutional meeting to attend, and so he forced to cancel this participation. But she wants to say to you, thank you very much for this opportunity. Breast cancer is the most diagnosed cancer for women in Europe. We know that many progresses have been made in the treatment of this particular kind of cancer, but the battle is not over yet. Prevention, early diagnosis, access to high quality treatment, availability of innovative medicines are just some of the key issues when we discuss cancer in general, but particularly true also for breast cancer. You know, the strong work that we want to do inside this mandate is very important. The job, the work of our intergroup of the European Parliament, the Challenge Cancer Intergroup. And in addition of that, in the European Parliament, we are also expecting the Commission to deliver the long-awaited EU Cancer Plan, which should come in the next few weeks. In order to support this program, the Parliament has established the Special Committee Beating Cancer Committee, BECA, where we are already started to work on a comprehensive report to present our priorities and proposals. We have made a very strong battle in ENVI committee, where we recently voted for an ambitious report on the EU for Health program. And we are we have a very strong opinion about the importance of the research and innovation in Europe that can be the key to win the fight against cancer. I'm thinking about the opportunity offered by information technologies, big data, but also the very promising studies and protocols under the broad category of genomic testing and diagnosis. If we want to succeed in this challenge, we can't deny researchers appropriate funding. I would love to be as brief as possible, so this is my main political message that I want to give you today. We need to stand together and call for a proper, well-financed, efficient and modern role for the EU in terms of public health, prevention and research. The last couple of months have made clear that health is a global issue where not country alone can be successful. This is the added value that Europe can bring to this fight. And I'm sure that our intergroup, the BECA Special Committee, and the Parliament will have your support in the next few months while negotiation for the next MFF. Thank you very much. A good work together.
Thank you very much indeed. And thank you also for your commitment. And I know you speak on behalf of many other colleagues, not only the colleagues you mentioned, but also MEP Fitzgerald, who's with us here today and who will speak to us again later at the end of this session. Now we have a little time left at the end of the session, and I would like to pass the floor now to Isabel Rubio, from the who is a board certified surgeon and is working in the Vall d'Hebron Center in Barcelona. And I would particularly like to ask you, Isabel, to say a few words about what you think is the biggest challenge for clinicians in ensuring that patients get access to the type of treatment that they need, and particularly access to cancer specialists. And I know that you're also going to make reference to some of the questions that have been asked in our Q&A session. And then, as you are also a member of the TBCT initiative, I would like you to say a few words about what TBCT is asking our friends and colleagues in the Commission and Parliament to do. So, Isabel, I'd like to pass to you, please.
Yes, thank you. All of that in 5 minutes. Okay.
Yes.
Well, thank you for this excellent webinar, for the outstanding speakers, and I think that the work we are doing will have profits in the next future. So regarding the high quality cancer care that I think it's important to mention, I just want to focus on two essential issues, and one is that the right of the patient to be treated in a breast center. But as we've seen in Europa Donna's survey, only 1/3 of the breast centers monitor their quality indicators. So this means that it's not that I call them a breast center. It means that the breast center has to have a group of dedicated breast cancer specialists, but are completely doing data monitoring and have external audits that make sure that they comply with the quality indicators. And I think that's the difference that we are seeing. And this is something that we need to really imply of having in all the countries. And also, I want to make a mention about the training of the breast cancer specialists. There are no, in surgery, and I'm a breast cancer surgeon, there are no specialty in breast cancer surgery in Europe. And I think that nowadays, in the 21st century, the patient has the right to be operated by trained surgeon oncologists. And this makes a difference because we know that the evidence shows that if you are treated in a breast center, and if you are treated by a specialist trained in breast cancer, whether it's a medical oncology, whether it's a breast surgeon, the outcomes are better. And we are working on this, and there are many European societies involved in this, EUSOMA, ESO, the European School of Oncology, GRETA, and many others, who are working on a certification for breast cancer surgeons. And I think this is a starting point, because we know that if you are treated outside a breast center certified with a specialist, you will end up having bilateral mastectomies that you don't need, poor cosmetic outcomes, and at the end, your quality of life will worsen. And I think that in this world now of breast cancer, that we are trying more and more to personalize treatments and to de-escalate treatments. I just want to mention one of the questions about reimbursement. I think that the escalation of treatments cannot be penalized by reimbursement. So if you are doing less surgery, if you are doing hypofractionated, that it's already a standard of care in early stage breast cancer, you cannot be penalized by you getting less pay than if you are doing more radical surgery that some of the patients don't need. So I think that's a point that we need to go together with the cost effectiveness of the treatments. And just to finalize, a couple of weeks ago, there was the European Code of Cancer Practice was launched. And I think it was a great 10 rights for the patients, for cancer patients. And one of them, the number 4, says that you have the right to receive care from a specialized multidisciplinary team. And we are working on that to push forward all the resources, the European Breast Cancer Societies, just to implement that the quality standards in cancer care are achieved when a patient is treated in any breast cancer place. So thank you for asking me that question, because I think it's important. The more information we give to the patients, the more the patients will be treated in a specialized breast unit or breast center. And we have heard all of the presentations in during this excellent webinar, and I just like to wrap up a little bit with the Transforming Breast Cancer Together call for a change that we have developed. And if I can have the slide, please. There is a slide. Okay, this one. Thank you. So just to conclude with the presentations, I think that it's important to show this call for change that has 9 points that are important and are the ones that we are working to improve. And as you can see here, invest in both primary and secondary prevention, ensure implementation of nationwide mammography screening programs, ensure that all women diagnosed with breast cancers have access to treatment in a specialist breast unit by a multidisciplinary specialist team, provide greater support to women who relapse and develop advanced breast cancer, maximize the opportunities for women to flexibly return to work, look after their families and contribute to society before, during and after treatment, support health professionals in improving patient-centered communication, ensure more attention is dedicated to improving the quality of life and emotional well-being of patients and their families, put in place a harmonized breast cancer registry process in Europe for collecting breast cancer data, both for early breast cancer and metastatic breast cancer, and finally, maintain a favorable environment for the development of innovative health technologies for breast cancer patients. And I think that this was developed by Transforming Breast Cancer Together group and capture all that we have said, and I think are important points to take into account for the Europe Beating Cancer Plan. Thank you.
Well, thank you very much. You did an excellent job of fitting it into that short time space that we have. I'm going to just take a couple of minutes to summarize very briefly some of the issues that we've heard today. And then I'm going to invite Francis Fitzgerald to close our session and to leave us with our call for action, our marching orders going forward. And I've just actually said marching orders hesitantly, because one of the commentators in the Q&A session said that we do need to be careful when using warlike terminology when we're talking about cancer. Speaking personally and having supported a parent living through cancer, I fully endorse that we have to be careful with using that language. And I chose my words carefully when I said marching orders. So I'd love to thank the presenters that we've had and the commentators that we've had. We've covered a wealth of issues. We've heard from the Commissioner, and we've seen the commitment from the Commission, the Parliament, the Joint Research Centre, the Commission, the Parliament, Joint Research Centre in driving forward the mission and the cancer plan, and recognising the diversity of engagement that needs. And I think in many ways that can be summarised in 2 phrases that we've heard today: the right to be remembered and the right to be forgotten. That is, the right to be remembered whether you're a man, a woman, young or old, the right to be remembered and to get access to the care that you need, including specialist care, but also the right to be forgotten when that is appropriate, the right to return to work, the right to be supported in work, in a way where you are both remembered and forgotten as is appropriate. We could go on for a long time on that, but I do want to make sure that MEP Fitzgerald has the possibility to leave us with her closing thoughts. So with that, I'd like to hand over to Frances, and also to thank the many people who've been on our discussion today. We've had a steady participation of up to 200 people, and you've been very active on the questions as well. Thank you so much. Frances, over to you.
Well, thank you, Petra. And can I say a very big thank you to you for your excellent sharing of this event. We've got through an awful lot of papers. I'd love to comment on each of them individually because I found them fascinating. I'm speaking on behalf of the Transforming Breast Cancer Together initiative, and on behalf of all of those who are involved in that, many of whom have been represented here today, obviously, the companies, the women themselves, the medical professionals, the NGOs. We can see the wealth of material that is available to us. The representatives from the EU who spoke to us very optimistically there, Kieran. I really want to say that I think this is a very appropriate time for a call to action. And even though we have the challenges of COVID-19, which are so serious, ironically, some of the issues around that in terms of flexibility of work, working from home, in terms of telemedicine, in terms of IT, some of that may well come together in terms of providing better services. But equally, of course, the challenge of actually reaching out and getting help and the barriers towards that are very big at the moment in terms of COVID. But I think what's clear is that services, as the Commissioner has said, have been improving. There are still many disparities, not just in Europe, but right across the world. Europe is actually leading. But we do have, from the point of view of Europe at present, we have a combination of a new program against cancer, the European Beating Cancer Program. We have very strong, as my colleague Alexandra said, we have very strong new committee on cancer, on beating cancer. We have the intergroup on cancer, and we have the new guidelines coming, and of course the ongoing implementation. We have big issues to consider. Ironically, you mentioned, the right to be remembered, the right to be forgotten, to be remembered when it comes to employment, to be forgotten when we're trying to get mortgages or insurance and so on. Very critical issues. So I think there's a strong program for action there. Nobody will do it alone. We cannot, as Fatima said, we cannot leave patients on their own. We cannot leave women feeling lonely because nobody is referencing what they're going through. So I think a real call for action on quite a number of areas, Petra. A very big thank you to all of our speakers who kept to the time so well. I think it was a very lively discussion. We will obviously bring together what has been said and try and make sure it's distributed more widely. And we'd ask our participants to do the same. Thank you for staying with us as well. I think it's been a very, very useful overview of the state of play in relation to breast cancer. It's a big issue. It's ongoing. It's like so many other issues. It's like gender equality. It's gone on for a long time, but it's ongoing. There are improvements, and there is still a action plan for all of us to deliver on, working together. Thanks again, Petra, and thanks to all our participants.
Thank you to you. And in fact, I would be very much remiss if I didn't close this session by thanking also my colleague Evelina Kowalska, who has really been the brains behind all of this session, who's worked so closely with the panelists. I was just here to be a face at the beginning and end. Evelina is the one who has really done so much work, and I think we would all like to thank her as well as thanking our participants. So thank you, everybody. We've taken note of your questions, and we will make sure that the questions are farmed out to the relevant people. With that, we wish you a very good rest of the day, rest of the week, and let's join together in transforming breast cancer in Europe. Thank you.
Well done, everybody. Thank you. Bye-bye, everyone.
Bye-bye.